Very good morning to one and all. Welcome to Pharmacy Education Webinar Series 10 by CL Baid Metha College of Pharmacy in association with Mybo Group on the theme of Advancing Scientific Knowledge in Times of Pandemic by Mr. Deepu Prabhakar, Clinical Pharmacist, Melbourne, Australia. So now I request our convener, Dr. Grace Ratnam, Principal, Professor and Head Department of Pharmaceutics, CL Baid Metha College of Pharmacy. Welcome, Madam.
Yes, thank you to the Mybo Group. A very warm good morning to one and all, and gives me great pleasure to wish all the teachers, the wonderful teachers who have gathered here, a very happy Teachers' Day. On this Teachers' Day, we are organizing the 10th webinar series of the college. And we have with us Mr. Deepu Prabhakar from Melbourne, Australia. So I welcome you, Mr. Deepu. Thank you so much for joining with us all the way from Melbourne to enlighten our students and the other delegates who have been registered for this webinar. This has been a long time in the pandemic for each one of us. And during this time, it has been a time of learning for us. And like the saying goes, on the flip side, if you see the flip side, we learned how to use our time and also how to use technology. So with these two together, when we have time with us and technology with us, we have been learning lot of things from lot of speakers from all over the world, and today we are so delighted to have with us Mr. Deepu Prabhakar from Melbourne, who's a clinical pharmacist. And this is one thing I want to tell all the delegates: the storm of the pandemic will one day end, and maybe we are sooner to its end. But during this time, it is so important to know what gain we have in knowledge to face the world after the pandemic. Especially for all the students here, the B Farm students, the Farm D students, many of them are in their final year. Once you finish this knowledge will gain you to go ahead, and also you can ask our speaker many questions about how to go and work in different parts of the world. And I take this opportunity to thank the management for giving us all these opportunity to conduct this, and the organizing team, with starting with Dr. Purushot Prabhu, Dr. Ubaidullah, and Mr. Vijay Kumar, Shiva Kumar Satish, who have been instrumental in organizing many of our webinars. So welcome once again, and I hand over to the Mybo Group. Thank you.
Thank you, ma'am. Thank you, madam. Before moving into introduction to speaker, so we have a small 2 minutes video on CL Baid College of Pharmacy. Thank you. So let's invite Organizing Secretary Mr. M. Vijay Kumar, Assistant Professor, Department of Pharmaceutical Analysis, CL Baid Mehta College of Pharmacy, to introduce our today's speaker, Mr. Deepu Prabhakar, Clinical Pharmacy, Melbourne.
And this is
Well,
the special this is the special occasion of Teachers Day all over the place. We are celebrating Teachers Day, and there are a lot of things or done efforts made by teachers, and this is the teachers are the backbone of the country and the pillar upon their aspirations, which are converted into realities in the young generations. And it was a quote by Dr. APJ Abdul Kalam, our beloved president, former president. Teaching is a very noble profession that shapes the character, caliber, and future of an individual. That's what teachers are, that backbone of the country. And he remembers that a student remembers the teacher as a good teacher. That is the biggest honor for the teacher from the student community and the young communities. So that is with this word, and the life and the time are the world's best teachers in our life, that teaches to make good use of time, and the teachers as the value of life. So this time teaches the value of life. That is especially in the pandemic situation. This period of time is made our value. I realize what we are doing and what is in our situation. So that with this quote, we are going to start our webinar today on this special day. It's my pleasure to introduce Mr. Deepu Prabhakar in our webinar series 10 for this presentation. And currently he is a clinical pharmacist in Melbourne, and he completed B Pharm and from Tamil Nadu, Dr. MGR Medical University, M Pharm from Trivandrum Medical College, Trivandrum. And he worked as a teaching pharmacology for medical students in Kerala, and then he worked in the drug control department, Kerala. With his efforts, he moved to Melbourne, Australia, and now he is a good person there working as a pharmacist, clinical pharmacist. And he completed BBA in Victoria University, Australia, and then he was joined as a clinical pharmacist there. Currently is working and and managing the pharmacies in that community sector. He owns his 3 own pharmacies in partnership in Melbourne and in one in rural Australia, South Australia. He is working as a registered pharmacist more than 12 years in Australia. That itself big achievement. We need to see, and we can get a good information from him. He involved in teaching IMGs for preparation of CAPS exam in an institute in Melbourne, and also involved in training local intern students there and in the pharmacy during their internship training. And he involved in Australian Institute of Distance Education and delivering excellent lectures and clinical skills of pharmacy system regarding and professional service to the pharmacist and students to gain their expertise in the practice of pharmacy professionally in the other Australia in countries, also in Australia and also in the Gulf and Singapore, etc. places. So involved in skills development for the getting the developing the skills in young students, and he is having as a practical experience in the Australia, and that will be, and whatever he delivers today will be useful for our students. Thank you, sir. Welcome you.
Deepu sir.
Hello.
Yes, sir.
Yes. Yes. Okay. So I hope everyone can hear me. First of all, I take this opportunity in I'm very grateful for Dr. T. Purushot Prabhu for giving me the opportunity to talk in front of you all, and giving me giving you the adequate information about the Australian pharmacy profession. And it's like a discussion. It's in regards to the various role of the pharmacist and what career opportunities we have here, and what are the pathways involved, and probably for some could be a study option. So because some may be able to study here for further, and some can go through the other pathways. So I have divided this talk into 3 or 4 sections in such a way that I would like to give you some basic idea of what's going on here. What is the different roles of pharmacist? How is the pharmacy set up? And the regulatory authorities, who governs it, who controls it, and some basic rules. And then we move ahead to different pharmacist roles here, and then we go ahead to the career pathways and opportunities, and also some of the basic view how we can utilize some of this service in India or in any other country so that we can make some change. So yeah, let's move ahead. Okay, so this one, as I said, it's a basic view on the profession and the varied roles. Then we discuss about the career opportunities and the study options for overseas pharmacists. Uh, so everybody will be having a different concepts and information. Most of them might have known about the pathways and a lot of it's oversupply of information, I would say, in this world. Um, you will hear 10 different things from 10 different people, and you don't know whether it's true or not. So I will try to give you some of the information, but not too much about the visa or immigration, because that's changed every day. So in this discussion, we'll go through the basic concept of each topic. Yeah, as I said, the main aim of this webinar is to show you how the pharmacy profession operates through the lectures or images and some videos. I'm not sure whether I can share the videos. Let me try at the end. And the regulatory board, which controls the pharmacy profession in Australia, like APRA, it's well known for Australian Health Profession Regulation Act, that controls all the health professions, and APC, PBA. I'm not giving you the many in-depth view because it's not needed now. Just the basic information and the government involvement, how the government is involved in the regulation and providing the pharmacy services to the public, like funding, for example, and also regulation, and what are the guidelines, standards, etc. Then it's about the overseas pharmacist pathway, as it may be a good information for those who are completed or studying in India now. So I'll go through some of the information in pathway, application, exam, registration, and some of the basic details. And what are the career opportunities? So there's a lot of questions coming to me through the email or in Facebook, through a different way, like whether they can come as a teacher, or whether they can come as a professor, or a CRA, clinical trial, etc. Lot of questions. So that's the main reason I thought of giving you this webinar, so that I can supply some of the basic information. Then lastly, we can discuss, or we can view how we can practically, and some of the services we can adopt. Whether we can adopt or not, that's a different question. Whether how we can adopt and uplift the profession and attain some trust from the public, especially in this in the coming century, because in the next 5 to 10 years, everything will be online pharmacies and online. So since it's going online, uh, whether as a clinical pharmacist in India, whether we can do something about it to change, because I don't think that everybody can go abroad and everybody can start a career. Everyone, they can't do that. So if they are thinking of working, or if they are thinking of starting a pharmacy a profession, like a professional pharmacist or clinical pharmacist or hospital pharmacist, whatever, whether how we can implement. So this is that's a discussion. Yeah, so so because I love to give this presentation, and you can find me this email ID if you want to have any information further. As about myself, this is just it is already outlined by in the introduction, so I don't have to go through this. So when we come to the basics, how we classify the medicines in Australia, what are the regulatory authorities, who controls it, and whether I can do that or this, etc. That will be controlled by the regulatory authorities, and what are the various pharmacist roles, and the details into different roles. So these are the first section. So the first section covers these 4 points. Once you get the basics, then you understand the how the system works here. So yeah, coming to the classification, in India, like we have seen like Schedule H, there are a lot of schedules as per the drugs and uh, class. I don't know the name now, but as per the drug schedule, there are a lot of classification in India. But now, but here in Australia, the mainly this 4 different type of classification. That's Schedule 2, 3, 4, and 8. So these are the 4 different schedules that are mainly involved in pharmacy. There are a lot of other schedules, but for pharmacy, it's only this 2, 3, 4, and 8. And, and there is one more that's like unscheduled that can be bought in supermarkets. Like for example, if you want to buy paracetamol, it has to be less than 24 tablets in a pack. Then you can go to the supermarket and buy it. But if it is more than that, then it can be only sold in a pharmacy. So that is the scheduled medication. Schedule means it can be sold only in a pharmacy and cannot be sold anywhere else. Only a pharmacy can hold medication. So this is the basic information, like schedule 2, 3. 2 means pharmacy medication, like people walk in and just they can take it, or they can ask questions and take it by themselves. There's no restriction. That's schedule 2, like for example, cough medicines or constipation medicines or cream or something like that. When it comes to schedule 3, these are the pharmacist involving medicine. Like it's kept inside the cupboard, or we can say that the public can't come and just pick up and go. So they have to wait, and they have to tell their symptoms. Once the pharmacist confirm the symptoms with them, then the pharmacist decide whether to give it or not. So once the pharmacist is satisfied, oh, okay, this medication is needed for that particular patient, then they give it out. That's the schedule 3. Yes, so many of them. Like when you're working in a community pharmacy, people first come to you, and not to the doctors, especially in rural areas and even in anywhere. Like people come to you and ask for the advice. Like I got, for example, I can't sleep for 2 nights, or I got constipation for 4 days, or um, whatever questions. So the pharmacist just interacts with them and asks questions. It's not like okay, constipation, take it. It's not like that. You have to ask questions. It's like whether like doctors do it, a history taking, similar to that. Once you do all the questions, then you give a medication accordingly, or you send them to the doctor. Sometimes they come, like for example, they come to your pharmacy with a heartburn symptoms. They will tell you, I got pain in the chest, and I couldn't. Last night, I had a indigestion problem. Um, so before giving it out any antacids or antihistamine, so we have to check whether it's a pain, radiating pain, whether it's pain going to the neck, or any kind of heart attack symptoms. If it is coincide, then we uh, forward them to the doctor. So that are the role of a pharmacist in Schedule 3. When it comes to Schedule 4, that is the straightforward prescription-only medicines. Doctors write script, come to the pharmacy, and the pharmacist dispense. counsel and give it to the patient. Schedule 8 is a sign, but it's a controlled. It's kept in a cupboard, locked cupboard, like morphine, those kind of controlled medication. As yeah, this is a picture of a typical pharmacy. As this is a big pharmacy, and Schedule 4 is kept here, like you can see here, and Schedule 3 pharmacists only are kept here, and this all everywhere, like whatever here is Schedule 2. This patient can come in and they can take it and go out, or they can come here, stand here, and ask for the pharmacist interaction, and they can go privately into the corner. They discuss or discuss their problems, and the pharmacist recommend. So this is the computer you can see. So the pharmacist stand here and dispense medication, taking the S4 medication from here, and once they call out the name, the pharmacist come out and give counseling. This is just the layout of a pharmacy. Yeah, so who controls the main? It's similar to FDA. We call it as a TGA. It's a Therapeutic Administration. They form the rules. Like they are very strict and responsible for regulating any medication, even sunscreen or vitamins, over the counter, whatever. They control and set regulations, and only the approved medication. Approved medication means somebody who is making a medication or making a drug, they have to apply to the TGA and get the authority, and then it becomes approved medication. That can be only sold or imported. So if anybody wants to import um, or export medication from India to Australia, it is possible, but they have to go through all this procedure through the TGA website and record this, submit an application. And there are few medications we are getting it from India, especially from Cipla, Reddy's. Um, Even there are 2 or 3 companies that are supplying medications. So it is possible, but it's very strict. They have to go through all this process to get the approval. If not, it became an unapproved medication and cannot be used. Even you can't even get those unapproved medications imported from anywhere, India or anywhere. It can be used for experiment, or if you're doing an experiment in a college or university, you can do it, or for personal use. Even for personal use, there are application form to be filled. So what I'm saying is it's very strict and regulated and controlled. And when you see what medications we have in a pharmacy, we don't have a wide variety of antibiotics. The main common antibiotics here use this amoxicillin or cefalexin. But if you go to different countries, you can hear the 4th or 5th generation cephalosporins, or even more than that, I don't know. But here they still use it in a hospital if they really need it in an IV form. But if you go to a community pharmacy, the first, as seeing a doctor, the doctor prescribes amoxicillin or cefalexin. These are the 2 common medications still prescribed here, and it's still working. So they're trying to control this antibiotics misuse, and not only antibiotics, for all the medications. So there is no wide variety of medications available. You can easily make a list of total medications in a single book, and it's very much controlled and less used. As I said, the regulatory bodies for health professionals in the sense doctors, nurses, everybody, like chiropractor or physiotherapist, pharmacist, controlled by APRA, Australian Health Practitioner Regulation Agency. They actually include devising standards for the overseas practitioners. They handle the complaints and training program, everything. So APC comes under the APRA. It's a section of APRA. They deal only with the pharmacy. So they are the ones who are involved with overseas pharmacies, like assessment or exams, whatever. So as a first contact, everybody from overseas will be contacting APC. So they have to go through the application through them. Once you go through them, then it becomes, after the professional registration, then you transfer from APC to APRA. Yeah, so it's just a basic thing about the we call it as a PBS system. Like a PBS system means it's a system, it's a subsidized medicine system where the government pays medication cost to the residents. It's a subsidy. It's we can simply call it it's like a ration. It's a ration similar to India, where some of the main like 100 or something. There is a list 100 and 120 medications comes under this classification. PBS means Pharmaceutical Benefit Scheme. Under this classification, the main life-saving drugs are covered so that the patients are able to afford it. I have given you some examples here, like say for example, if a medicine is covered by the government, if the cost is $500 and is listed under the scheme, then the patient maximum they have to pay is $41. And if they don't have any work or whatever, they're less low income earner, then they pay only $6. And the remaining, say 536 whatever dollars, paid by the government to the pharmacy. So this is how the system works. So uh, it's not every medication is covered. Say for example, if someone wants to uh, buy a medication to reduce weight, then it's not covered. But for blood pressure, cholesterol, all these medications, most of them are covered. So that is the subsidized medicine cost. So because of this system, the pharmacy is linked to the government rebates. So there is a strict control over the number of pharmacies. If you want to start a pharmacy, it's not easy. You can't just go and start. There is a location rules, regulation, and you have to satisfy all these rules to go through all these steps, and then only you can start. The license is getting very harder. So this is the basic way the government works in terms of pharmacy subsidized medication. So there are different states in Australia. They have their own pharmacy board, and they set their own rules as well, in addition to APRA. And the Pharmacy Board of Australia is the one which comes under the APRA. They set the guidelines for the registered pharmacist here. The one I said previously, APC, like Australian Pharmacy Council, that's for overseas pharmacies. When it comes to the registered pharmacies, the PBA, Pharmacy Board of Australia, that oversee the registration standards, guidelines, how do you practice, they change it. So there are a lot of set guidelines they have to follow. So what you do when you like when you dispense, what you do when you counsel, what you do, etc., etc. Like it's like a step-by-step protocol pharmacist has to follow. They set the guidelines and code of conduct. So some may be asking why they're making a so much lengthy process from writing CAPS exam to internship to exam, again internship, I mean again exam and oral exam. The reason is the government is very strict in because they're dealing with the life, so to protect the public, and they make everything very strict and not easy. Like it's not hard, but has to be under certain guidelines. So that's why they make it very. Um, it's not lengthy, but it's like a system protocol so that the pharmacists come through this and go step by step until they get registered. So there is nothing like people ask me whether I can work as a what is called assistant pharmacist or trainee pharmacist or unpaid pharmacist. There's nothing like that. No one can work like that. You should have a registration, some kind of registration. There are different type of registration, like limited registration, professional registration, or general registration. That's the last part. One should have a registration to work in a pharmacy. There is nothing like assistant pharmacist or unpaid pharmacist or trainee pharmacist. Nothing like that. You have to go through the exam and get the professional registration to be inside the pharmacy. So if you're not, you can't use the title pharmacist or chemist, and even you pass the pharmacy or PharmD or any exam, they cannot do that until they get the professional registration. and get the internship. The internship is called a supervised practice arrangement that you have to find it and approved by the board. So that's the basic registration process. So why we are making the registration process very strict? Because anyone can make a complaint against anyone. If they make it very simple, then to do a mistake, then you'll be sued. Like they can go to the pharmacy board and make a complaint against you. There are a lot of complaints will happen, like performance or what do you call, like behavior or like dispensing error or wrong strength, communication or not speaking properly, anything. Communication is very important. So in this case, they can make a lot of notifications. So that's why the pharmacy board make a strict or defined guidelines, I would say, to make it everyone go through the guidelines and make it everyone easy and simple and safe for everyone. Uh, yeah, so for a pharmacist, whether you're in a hospital or in a community or anywhere you go, the main qualities for pharmacists are very good communication skills, like written and verbal. When I say communication skills, it's not about speaking, also listening. Listening is very important. We have to listen what they're saying, understand, and not speak very fast as well. Like they say that we are speaking very fast, but to speak stable, constant, slow, and attention to detail and good. Then the rest of them come by itself, like management skill, decision making skill. You have to work in a team as well or independent. Even though you are the owner or manager, you're not the. You can make a decision, but still you became a team. So you have to be like one among them, in other words, and very outgoing personality, very important. So it's more important than having an extraordinary academic knowledge. So they don't here want someone with a great academic knowledge. They want someone with a minimal but very good outgoing personality. So when it comes to different roles, so there are a lot of roles for pharmacy. It's not like community or hospital. There are different roles. The community and hospital is more prominent because as an overseas pharmacist, you can come only through that path. Either you come through the hospital pharmacist visa or retail pharmacist visa, or there's one more industrial pharmacy. But there are a lot of other sectors. Once they come, many people will go to different sectors, um, like clinical trial, or they take specialization, like doctors taking specialization in cardiology or similar to that. The pharmacist can take an extra step forward to become a like a diabetic educator here, diabetic educator, or MMR, medication management review pharmacist. These are the roles created for the professional providing good professional service to the public. The MMR is nothing but like you review the chart, like for the doctors or the medication history. So you can go to the pharmacy, I mean, the patient's house, sit with them, and you can find what medication they are taking, make a list, you can make a report, those kind of things. They are the MMR pharmacists. There are a lot of roles. But when it comes to community pharmacy, it's a major sector because it's the first point of contact for a public. When there is a need when there is a need in the public or anyone, they come just to the community pharmacy and ask for the help, like I want this, I want that, etc. So it's a major sector, and there are a lot of roles inside a community pharmacy, starting from owner, pharmacist in charge, manager, lot of roles. A little bit about the industry. Industrial sector, you don't have to be a pharmacist, registered pharmacist to work in the industry. Um, so I don't know much about people coming as an industrial pharmacist from overseas, but I have seen like local students studying Bachelor of Pharmaceutical Science in Monash Uni or any other university to work in the drug research field, biotechnology, or in the university where there are Once you finish this, you can apply for a research assistant in the university itself and take PhD and go that pathway. There are still students doing it. It can't work as a pharmacy. If you want to study again, Bachelor of Pharmacy, Master of Pharmacy, then follow the pharmacist pathway to become a pharmacist. And yeah, so this industrial pharmacist is categorized in the visa process. There are certain numbers like 190, 491, 494. The different numbers there are. So under these numbers, you can find all this information under the immigration website, the Australian government immigration website. So if you go through these numbers, they'll tell you what are the whether you are eligibility criteria, point-based system, etc., etc. So yeah, so still pharmacists can come as industrial pharmacists under this visa process through the skill assessment authority. But it can change every time. So how to look further, always do research about the visa. That's a different section. So I'll go through it later. Yeah, there are clinical trial jobs, CRA or there are few jobs, but you don't need to be a pharmacist. It can be a healthcare professional like a nurse or a doctor. Anyone can do a can join a clinical trial jobs. And this is the example I've given. Like I have seen one advertisement for a job ad, like clinical trial pharmacist from Nucleus Network. This is a company. They wanted a pharmacist, but they have to be a citizen or a resident here. They don't give, they don't sponsor. So you need to come through either retail or hospital way, get a pharmacist registration. Then if you're really interested, then you have to go through the other pathway. So if somebody wants to come here without a proper visa, then this may not be a good option, but it depends on their individual circumstances. So, but it's good if you have a prior experience of GMP and CGP experience, and if you can study a course which is similar or just on par with Australian standard, it's more better. And this is just a basic information. Anyone can join as a CRA with a nurse or pharmacist or doctor with a licensed professional, or even with a degrees and any degree with a experience. It's good to have, if you are looking for this path, it's good to have a working knowledge of CGP guidelines, international regulatory requirements, and possibly a course. If you have a if your parents or relatives are already here, you don't have a problem in visa, then you can opt for this to have a basic um, requirements fulfilled before you come here. Then it may be easy to get a job. Yeah, so it's a major sector because I'm focusing mainly on community pharmacy because this is a major sector, and most of them overseas pharmacies, most of them work in this sector. So as I said, when anyone have a problem, they come straight to the pharmacist at the first point of contact. It's a highly paid and rewarding career after adequate experience. So once you get a bit of experience, there are still jobs available in Australia with highly paid, especially in rural areas. There's a lot of shortage, and still it's a highly paid job compared to any other profession here in Australia. That you can do a research, and it will tell you it's one of the once you study the course, once you pass out, you'll get a job very fast. I think I read one article within 1 month you'll get a job. So it's a this is a normal setup of a small pharmacy compared to the earlier one I showed. Like these are the S2, we call S2 medications. You can see here cough, allergy, like Panadol, Nurofen, get here. So there will be pharmacy assistants in the floor. When I say pharmacy assistant, they are not pharmacists. They're just those who get a certificate course here locally and they work as a pharmacy assistant, they work in the floor and the people come to them and ask for advice. If they are able to give advice on this one, if not, they will refer to the pharmacist here. The pharmacist inside the dispensary come out and speak to them. So this is just the normal small pharmacy setup. So it's a discussion regarding to the some of the roles in the community pharmacies. So as I said before, medication management pharmacist. It's an interesting job where you can visit the patient's house. You can make an appointment and go to them. You go to the house, interview them, look especially for elder patients who take like 10 or 15 different type of medications and multiple medications we call. So it's this one is funded by the government. Like if you do this, you can get rebate from the government as well. So it's a like 1:1 interview to discuss about the dosage or side effect or whether any concern they are interacting, whether they are having, or if they can't take any tablets, then they recommend similar or alternative substitute in a liquid form. Lot of things can be done, and if they want to change the medication, you have to submit a report, and the report is submitted to the doctor, and the doctor will change it according to the pharmacist's advice. That's one of the good role, I would say, for a pharmacist to enrich their profession later on. That's a picture of a home medication review. They ask questions and make notes, and they change it. We make a report and send it to the doctor. Yeah. So when it comes to the pharmacy owner or pharmacy ownership, I would put it ownership. Only a pharmacist can own a pharmacy. Non-pharmacists cannot own. When I say non-pharmacist, even a doctor can't buy a pharmacy and run it with a pharmacist. They can't do that. The profit or money comes from the pharmacy, has to go to the pharmacist account. It should not go to any other account. It's very restricted, and only one business in Australia that's like this, very restricted one. So the non-pharmacists are not allowed to start or own any in any way, in any different form. The profit cannot go into their account. So it's very restricted, so that the standards, the main reason is to keep up with the standards. They don't want the pharmacy profession to make it like a supermarket where just sell like 10 Panadol or 20 packs to everyone. They make it as a strict control. They trust pharmacists. So they make it in such a way that only the pharmacist can own a pharmacy. And I said, it's controlled by the government. You can't start a pharmacy as like you want. It's by distance, like distance from the present pharmacy, whether there is, yeah, you need to satisfy a lot of requirements. I'm not going inside deep. And it's very restricted and safe business. But when I say safe, it still has got challenges. As I said, slowly there will be a lot of changes happening here, like e-script or online pharmacies. When I say online, it's not can't be fully online, but online pharmacies already started. Still, there is a restricted business compared to any other profession. So to become a pharmacy owner, after working as a pharmacist for some years, you will get the confidence and the qualities to lead the team or to understand the finance of the business or what management, overall management to improve, or training or business planning, policies and procedures, or what state and guidelines you have to follow, etc. Like you have to know these things, then you move ahead. So other position inside a community pharmacy. So pharmacist owner is one of them. It could be practicing or non-practicing. You don't have to practice. It can be non-practicing, but some states want the pharmacist to be practicing, some not. The pharmacist in charge, after like 4 or 5 years experience, then the pharmacist becomes an in charge. There will be one in charge for each pharmacy to overlook all the general operation and how manage the team and like it's like a manager. And then there is experienced pharmacist and pharmacist. So once you start as a pharmacist, then you become experienced pharmacist, Then he became pharmacist in charge, and some may go to ownership and some may not. And when it comes to non-pharmacist roles, there will be a retail manager who look after the shop front. A lot of, as you see in the picture, a lot of stock in the front. So pharmacies are not like a small shop. There should be a very big shop, at least a minimum shop front with all the stock. So and also they should have some different, like we call it the professional service area, like a different eye care or for stomach like different section. You have to keep a different medication. So there are pharmacy assistants. There are non-pharmacists who do some course here, like 6 months or 1 year course, and then they work as a pharmacy assistant. Yeah, so this is one of the new concept. E-script means just moving from paper script to the digital version. So once the implementation is finished, the patients can come with a QR code in the mobile, and the pharmacist can scan it, and all the prescription details come into the computer, and they just dispense from the computer, and the medication can be dispensed. This is a new thing introduced recently. Yeah, so it's a different pharmacies there, like a medical center pharmacies. Like you can see a medical center here. People walk through the pharmacies and go to the medical center. They can have a patient counseling, get the medication. It's like a single stop service, so that the patients get everything in one place. So what are the services provided inside a pharmacy? So there are a lot of services provided. It's not only like patients come with a script, get a script and go, or just not only counseling. There are a lot of service that's more important for the viability of pharmacy here. Recently, in last 1 or 2 years, the government has given sanction to do vaccination or injection for certain type of vaccines, like flu vaccine. If they find a COVID vaccine, definitely first point of contact will be pharmacies. Um, but the pharmacist can now give vaccine from 10 years over in regards to the flu, hepatitis, and slowly it will be increased. So vaccination service, and they do a lot of other service like blood pressure check or glucose or a cholesterol reading. So these kind of checks. Some may give it free, some may charge some professional service fee, and also for asthmatics like inhaler technique, or you can provide lease certificate. If somebody is sick, the pharmacists are authorized to give a sick certificate to them so that they can take it to the employer and it's valid, and they can give some. They can provide health check and compounding. When you say compounding, means it's a mini production, like lab. Like you can make your own cream or own tablet, not tablet, capsules and creams and liquids according to the prescription. When there is no commercially available products are available, the pharmacist can make it and supply to the patient. So I'll show that in detail later. So yeah, it's a blood pressure check. Like you take the patient to the professional service area in a small consulting room. The one thing here is privacy is very much considered very important. So you can't discuss a lot of things in public. So privacy is, there is a privacy act itself. Breaching the privacy is considered as a very serious issue and a lot of fine. So anyway, that's a different concept. So in a pharmacy, you can do a blood pressure check, take the reading, and if it is too high, you send them to the doctor. And if it is like moderate, like 140s or 135, then you take the recording and ask them to come back later. So these are the services actually making the profession trustworthy, or what you call, like people still come back to the pharmacist. So if they can have the medication labeled or counseling, they can go anywhere. Like after 2 or 3 times, why do they want to come to the pharmacy? They can just order online and get it delivered like a pizza. So these are the changes, or or some sort of implementation can be done in any country, so that even to start with in a hospital, like when you say that these services can be done in outpatient services in a hospital, public or private hospital, so that the profession is trusted. Um, so and do some, we can make some changes in the future, and it's the best way to compete against these big multinational online pharmacies. And so yeah, so you don't need a prescription for a vaccination. They just come to you and get this vaccination from a pharmacist. And yeah, the pharmacist giving immunization or vaccination. And as I said, it's a compounding. Compounding means you make your own capsules or creams or syrup when there is no commercially available product, and it can be done with a prescription, and you can't sell to the public. If you want to sell to the public, you have to get the TGA license. So the pharmacist here making it's a small capsule machine with 100 capsules. So he's making a capsule for medication which is not available commercially. Can do that with a doctor's script, um, and it has to be for a specific patient and cannot be sold outside. So there are a lot of screening. So I'm not going detail. Like if, someone can test anemia and they come to the pharmacy, like they check, especially for the pregnant. So so you can create some pharmacies, they make it as a specialist in certain services like pregnancy consultation service. So all the pregnant goes to the particular pharmacy. So making a brand, like a specialized brand. Some would say they are very good at providing sleep apnea services, or providing snoring relief, etc. Like compounding is one of the specialists, so that that people know this they're specialized. They go to them. So yes, a COPD screening, and just to outline what the pharmacists are doing here. So it's like a small machine where they blow and they can check the progression of the COPD, whether it has to be consulted or further referred to a doctor if needed. And weight loss program, there are a lot of approved weight loss program, lifestyle program, because of the obesity. Some, yeah, as I said, some pharmacies make it as a specialized thing, like in their pharmacy weight loss, so that people still come to them. So in this way, by doing all these services, they still have that patient base, or it's still a business. So the business has to go on. So by giving these kind of services, so you can, or anyone can provide create a value, and resist these changes that some other companies propping up, um, like like online pharmacies slowly disrupting this service. Diabetic some of the major areas. So people come and they want to test your blood sugar level. Most of them have their machines, but they still want to come to the pharmacies, and the pharmacies make a recording. If there is a constant interaction from a pharmacist to a doctor, so they record it and send it to the doctor, so that they still come to the pharmacies. And yes, sleep apnea service. So they can come and to the pharmacy and take home a monitoring device, so that they can check the whether the sleep apnea is a problem, or it's a continuous positive airway pressure to keep your airways open to stop the sleep apnea. This is the machine. And the diabetic education. So there is a new role called diabetic educator, where different type of there are different type of insulin devices, or what type of machine they use, a lot of things. So the pharmacist can study diploma, or whatever course they can they can become a pharmacist educator. They can do a specialization in this area, and work as pharmacist diabetic educator. It's one of the profession. And medication review in aged care setting. So population of age are increasing day by day, especially in the aged care sector. So since there are a lot of aged care here in Australia and other countries like UK, USA, there are a lot of aged care where the aged population, it's like a hostel for aged people. So they live like 85 years, 87, 90 years old. They all in that aged care. So they take a lot of medication. So the pharmacists service those aged care homes by providing a specialized dose administration aid where they put everything, morning dose in one section, on evening dose, and night dose, so that they don't get confused. There are nurses to take care, but since there are a lot of age people increasing, the government are considering a lot of rebates for this area. And now it's a new concept. It's inside the doctor's clinic or in a hospital, where the pharmacists work along with the doctor, and when the doctor write a prescription, they can do. It's not a hospital. It's a general practice. It's inside a clinic, like a small medical clinic where the pharmacist can work alongside with the doctor. They can advise to because sometimes doctor doesn't know everything about a medication, like what anticoagulant you can use, what brand use, or whether you can stop. Like say for example fluoxetine, we can stop fluoxetine and start sertraline tomorrow, or how many days you wait to start from one medication to another, or whether there is any interaction between venlafaxine and atenolol. A lot of questions will come, so the pharmacist can go through it and review and make a suggestion. This is one of the new role funded by the government. Patient counseling is one of the very well-known thing here. It's not like a service. It's a job. It's one of the job. It's one of the job of a pharmacist. Like it's not a specialized service. It's their job. They have to counsel the patient, and once you dispense, they have to counsel. They have to ask questions. The patient will be asking questions. They have to deal with all those things. When I say about patient counseling, when the patient comes, say, for example, with a prescription like perindopril 5 milligram, and when you start dispensing the perindopril 5, you see that the previous dispensing history, it's a software. You see the previous dispensing is 10 milligrams, then it's not like you dispense 5 and give it out and counsel. So you have to go and ask them, you had 10 milligrams last time, why you want 5 if the doctor changed it? The patient may be confused, they don't know. Then you have to ring the doctor and call the doctor and say, hi doctor, I got a patient here and he's taking 10 milligrams, but he's bringing a 5 milligrams, so I want to confirm the dose. So the doctor will be looking in the system and they say, no, it's 10 milligrams. So then you have to go back to him, you tell him, no, you had 10 milligrams previously, go back to the doctor and get 10 milligrams. So these are the patient, like you have to intercept, the pharmacist has to intercept in every section. Like it's not like you get a script, dispense and go. You have to do the history taking, what they take, whether the correct dose or any interception needed, or the sending to the doctor. There's a lot of this is a basic thing. There's a lot of things involved. Yeah, so as I said, the pharmacist can provide a lease certificate or sick certificate to anyone who is sick. They don't have to see a doctor. They can come to the pharmacist and get 2 days leave. Now the government is considering extended pathway for a pharmacist. What I mean is to dispense few medications like trimethoprim, nitrofurantoin, cefalexin without a script. So generally you can't. No one can dispense without a script. You need to have a script to dispense S4. So now the government is trying. The patient can come straight to the pharmacy and ask for a if they have a urinary urinary tract infection, and they can the pharmacist can go through the protocol. If the pharmacist find out could be a urinary tract infection, he can prescribe trimethoprim and dispensed without without a script. Slowly, it's progressing, and there are a lot of trial programs going on, like mental health. Mental health is very important because it's getting very more in Australia, and the healthcare homes, because of the age. So yeah, as I said, a rural pharmacy is one of the main pathway where the overseas pharmacist can come here and work in certain areas. So without this rural pathway, it's very hard for overseas pharmacists to come here with a certain visa because the immigration department open visa according to the rural index, like whether, for example, if you take Victoria, it's one of the state, there is no skilled migration program like 190 or 189. I'm not sure whether it's changed, but because um, because it's not considered rural, it's all like an urban area. But if you go to like New South Wales or any other rural areas where there is a need for a pharmacist, then um, they open the gate for overseas pharmacists. So rural, that's why rural pharmacies are most important for the overseas pharmacists to come inside Australia. Yeah, so when it comes to the hospital pharmacies, I just go fast, very fast, like overview of medication use, medication chart, dosage, like adverse effects, interaction, provide education to the doctors. It's a lot of things the hospital pharmacist can do it here, and it depends on different hospital to another. And the hospital pharmacist can take specialty. Once they became a hospital pharmacist, they can take specialty in other areas. Say, for example, oncology pharmacist, or nuclear pharmacist, whether they interact with the radio pharmacy and personal information pharmacist, emergency medicine. There are a lot of subcategories. So when it comes to the overseas pharmacist pathway, there are three pathways. There is a knowledge stream pathway, like CAPS pathway. It's a very common pathway for India and other countries. And competency pathway for UK, USA, Ireland, Canada. And those who study here, like somebody from India or any country who wants to come here and study, it's called international student pathway. So these are the three pathways where one can come inside India, inside Australia. It's a As a glance, everybody might have gone through all this information from the website, but just as a glance, you need for CAPS pathway, you need a skill assessment letter. Um, with this letter, you can apply for a professional registration. For this letter, you need to apply for eligibility, whether Farm B or B Farm or M Farm, whatever is equivalent to the B Farm or B Farm course of Australia. Then they'll give you eligibility. Okay, your course is eligible. Then you write CAPS exam. You pass the exam, and that validity is for 3 years. Within 3 years, you have to register as a professional pharmacist. But only with this letter you can register professionally, and also you need this letter for visa steps. You can seek the visa steps in the migration department website. It's a big thing. It's a big chapter, so I'm not going deep. And after professional registration, the CAP pathway finished. So then you enter into APRA. Like you have to find the internship for 1 year, and that should be paid, not unpaid. Then after 1 year, you have to write the exam. Then you are a registered pharmacist. So this is just a quick pathway, not detailing. Maybe once this seminar is over, you can go back to the slide and have a read through what all you need. Just passing the exam, eligibility exam, eligibility check, CAPS exam. You can write the exam all over India, like Chennai, Bangalore, Hyderabad, Delhi, and Mumbai. The next one, the registration is next month, 2020, and the exam is 8th of December, but you have to check all these details. This is the rough estimate cost involved for this eligibility and exam. And just a step by step, you need this for the eligibility documents. Everything is in the APC website. Just go through that. Identity, academic. You don't need a work history. You don't need any work history. but it may be needed when you apply for the visa. So there's a lot of questions coming on this, whether I need to show 1 year experience, 2 year experience. You don't need to show any experience for CAPS, but for migration visa, you need to show. So it's easy if you can show for both the same experience. The experience has to be only in a retail or a hospital or industry. Again, IELTS or PET or OET, you don't need that for the exam, but you need it for when you're applying for the provisional registration. I've just include this one. You can come later and have a look. What are the process steps involved? As a general rule, you don't need an OET or ITS for appearing the exam, but you need for provisional registration. And these are the steps involved. The results are valid for 3 years, then you have to get it registered as a provisional, then the visa probably starts. There are 2 papers for the exam, one chemistry, physiology and ecology. Even though the chemistry questions are less, it's very important because as you can see here, you need to have a 50% pass rate in all subsections. When I say subsections, you need to have if you do very well in physiology and pharmacology and not in chemistry, you will fail. So you need to have a knowledge, 50% knowledge in this, and this. So especially the stereochemistry, you need to have a good knowledge about the stereochemistry. You can find previous questions in many websites. So yeah, after CAPS, so many people are asking, well, after CAPS, what should I do? You have to wait for the immigration department to open the gate. It changes every month, and you have to wait and apply through them. So you can't, since you know someone in Australia, they can't take you, or they can, but it has to be under employer-sponsored visa, like a pharmacist, a pharmacy owner in a rural Australia, they can do that after processing so many applications. But those who are not in a pharmacy, they can't take you and give a job. It's not like a Middle East or Gulf country. There is no job visa here. You need to apply through immigration department and to get this visa. Yeah, just come back and see all these steps. I think it's just run fast. Skill assessment letter will be it can be renewed. Just run fast. Professional registration you need, and the validity is 1 year. Within that 1 year, you have to find internship and finish the internship. And this is for the CEO second pathway for those who are from UK and New Zealand. Same thing like CAPS, but they don't need a 1 year internship, maybe 3 months or 6 months, whatever it is. Because since they are from the similar countries, they're practicing the similar standards, the practice or the internship is very less for them. So whatever you hear here, do your own research for the updated info, because this one can change tomorrow. So studying, it's good if you can afford, and if there is a possibility, I would recommend this pathway because you can go through the third pathway, bypassing the CAPS, and plus you will get exposure in a community pharmacy. So you'll be considered as a local student. So if you can afford, so when I say MPharm, Master of Pharmacy, University of Sydney, 2 years, the roughly will cost you like 40 to 50 grand, 50,000 per year, Australian dollars. So if you can afford it, it's good, but it's not for everyone. Once you finish this course, you get this internship because you already, but while you're a student, you go for a training in a pharmacy. So you get used to the system. So the employer will be willing to take you easily. So that is the main part. They're spending this much money. Exposure visa, it's easy to get a student visa than a migration program. There are a lot of things, so you can opt those who want to go master in pharmacy, they can opt. If you are looking for a PhD, you have to go through each university. Say, for example, Monash University, careers, then you have to look the PhD in that. And but again, the problem is visa. So um, it could be very hard to come here to study PhD. You can study with the student visa, but after that, how do you transfer? That is the question. In Victoria, it is possible because if you complete a PhD in pharmacy or any profession here in Victoria, you can apply for a visa or permanent residency. So it depends. So these things, studying and visa is interrelated. So you have to do your own research and choose a course and study in that area. It's I'll just give an example of a master's here for a Sydney program and bachelor's from a CS Chatsworth University. It cost roughly $30,000, and if you study here, it is recognized by Singapore Pharmacy Council as well. So you don't have to go through all the pathway in overseas. Some of the overseas they consider bachelor's degree of Australia that you can register straight, and it's very interesting here. Like once you join a course after 1 or 2 years, you can do uh, remaining studies elsewhere, like you in UK, or you can go to holidays and practice somewhere. It's a different system here. So you can study some here and study overseas and practice overseas. There are a lot of scholarship available. You have to go through each and every program and every university to know what, if you are interested, to know the eligibility and the fees and affordability, etc. So this is the general visa thing. You can, it's only for retail, industrial, hospital. These are the number of different subclasses of visa. The most important, I mean, most common is 190 skilled nominated and 491 skilled work visa. The next slide. So yeah, there's a training visa. So those who want to come to Australia for 2 years just to do the internship, they can apply for a training visa through their employer. You can't just apply your own, through their employer. So if you have an employer, they can apply on behalf of you, get 2-year visa. Once you complete the internship, then you can apply again to bridging visa to find a appropriate visa to stay here permanently. Or if you think that's very hard, then you have to wait for 190 visa. You have to apply through skill select. It's like a gate. It's like a gate. You have to wait until the gate is open. So every month or every certain period, the gate will say we need 80 pharmacists in New South Wales. So it's a point-based system. If you go through skill select, you can see it's a point-based system. The minimum is 65, but you need to have at least 85 points. When I say points, it's like, for example, age. There are points for each category, like experience, etc. So those who can get 80, 85 points, they can apply and express their interest through the skill select and wait until the government or department call you. Then it's a 491 visa. It's only the 190 and 491. So 491 is state nominated. Like it's a particular state. You have to be in that state for a certain period, like 3 years, and when you say state nominated, that profession should be in the skilled migration category under that state. Mostly pharmacist, retail or pharmacist, industrial pharmacist or hospital pharmacist will be under that list. Same thing, expression of interest and weight. These are the examples in 2019. What happened is in Northern Territory, there was an invitation occurred with the point 70. So in 2019 October, I just took the details for to show some example what points they had previously. For Victoria, there is no 190 visa, but if you have a PhD, within 5 years, you can apply for that visa. This different, yeah, this is a different criteria and different point-based system. New South Wales, you need to have 85, even though it's a 65 basic. They invited only those who have 85 and above. So you need to find what the point-based system is, how you can get this point-based, etc. So yes, it's just a small discussion. Why here, when I say pharmacists are good, some some pharmacies may not be performing very well. Some are struggling. Because why the customers or the patients should come to your pharmacy or the pharmacies in a hospital to get the medication and get some like minimal service, like take one in the morning with food, and that's it. They know after one or two times, they know they had to be taken in the morning. So give some external extra service, definitely will make a change. And some say the doctors are not supportive. No, it's wrong. Some doctors are not supportive, but I believe they will be supportive once the pharmacists prove their worth or they prove their clinical skill set. So that change should occur, and slowly it will change. And once it changes, the doctors will get the confidence and or what do you call, they respect the pharmacist in terms of this providing this professional service. But not only here, I'm talking about in India or any other country as well. Yeah, so I think this is a small discussion about Amazon. They are started last month in Bangalore, and they will conduct pilot studies in implementing the online pharmacies. In next 2, 3, 4 years, everybody will be online. So it causes a disruption like Uber. It might cause a big disruption. So um, ultimately, the dispensing pharmacies will be like machines who just check it and pack it. So how to stop it? We can only do something in terms of providing service. It's very hard. Like I read an article recently saying that 850,000 pharmacies in India wants to shut down the Amazon. Could be possible for some time, but it's very hard to resist digital transformation because it's more cheaper to the public and they will welcome it. And no, there's no point if the services are staying. If you go to the online store or the physical store, well, they get the same medication. Politics may play a role, but not too long. I would say the main thing we can do is to provide some of these, implementing some of these, like blood pressure check. Anyone can buy a machine and provide blood pressure check through the community or retail pharmacy in India. You don't have a privacy issue there, big privacy issue there, or you just do some providing to make this present public or present customers come to you still, and will make a big difference. A small thing will make a big difference. So this is just my view. Whether we can do something about it, to start from somewhere, because there are a lot of organizations in India, and there's a lot of pharmacists in overseas, not only in Australia, in US, UK. I got so many friends who are interested to implement this kind of system or help in this kind of system and implement some of these in a retail or to start in a hospital pharmacy to make some changes so that the profession will be trusted and valued by the generals. So it's hard to resist the technology. It's very hard, and the only way to make it is to provide a personalized professional service. So to make it simple, when you ask me, if you ask me of overseas pharmacist pathway, it's a long journey. So you have to make informed decision, approach with proper planning, finance, very important. Start from, don't take it light. Don't think that when you come here, you can work in a petrol station or somewhere and make, it's not going to work like that. And don't fall into any travel agents or any type of coaching centers promises. Some may take money from you, and it doesn't work like Middle East. It's not like a Middle East where there is no recommendation here. There is if you know someone, the reference is most important. They will give you reference if he's really valid. They don't do any what do you call, illegitimate reference or something bad reference with good review, but it can make a big difference. But there's no point in giving money or to any agent and make it meet as a priority. They can't do anything much. They can give you some information, but they can't push your application. So to say, to finish it off, as I said, it takes a dream. If you are very passionate, to come here or any overseas, it's a dream. You have to keep going, take some years to finish, and I think it's time to finish here. So I take this opportunity to thank Dr. T. Purushot Prabhu and all other delegates in giving me the opportunity to talk to you and have some discussions about this. And I thank Professor Dr. Grace Ratnam and Dr. Vijay Kumar, Mr. Vijay Kumar sir, and Vaidullah, Mr. Satish Kumar, and Mr. Shiva Kumar, giving me the opportunity to speak before you. And I thank everyone. Thanks.
Thank you very much, sir, for giving all the brief out of the courses and clinical pharmacy and how to enter into Australia. So I'm highlighting few questions. Please answer to few questions, sir.
Okay, sure. Yes. What are the language tests you have to complete to enter Australia? Yeah, as I said, uh, if you are appearing for CAPS exam, you don't need English test, but it's better to prepare for now. Either IELTS, OET, or PTE, and you need 7 individual, total 7 in IELTS. But you don't need this score when you write the exam, but you definitely need it to enter Australia. At least IELTS 7 or OET-B or 65 or something in PT, but you have to refer the updated version that will change every time. So it is even hard to find an intern position, not only for overseas graduates, for local graduates as well, because intern means it's not a full-time job. Someone has to train you. So it's a business. So money is involved. So if somebody is going to train you, intern pharmacist can't work as a full pharmacist. So everybody can't come and I mean everybody can employ everyone. So, but it is possible. Everybody who comes here, a lot of Indian pharmacists working here, and they're not only from India, from Egypt or Pakistan, everyone. They come here, they look around. Ultimately, they will end up in getting one somewhere, especially in rural areas. When I say rural, it's better to go to rural because a lot of mm, opportunities available in rural, and you will definitely find an opportunity. Yeah. We write an entrance in case we are directly promoted by any company. For a role of CRO, I don't think so. You don't need any entrance or any. You don't need any exam. First of all, not only from a company, for anyone for a role of CRO, you just need an experience. But the main thing is that visa. If you can satisfy the visa, there is no problem in it. So the visa category is a different in this case. So I have to check with that. Indian graduate student became or get pharmacist job. The process is as if you go through this slide, I think there is a recorded version, CAPS pathway. Once you finish the CAPS pathway, you have to get registered and look for a job. Like in India, like you have to pass the exam and go to talk to the employers, and you will get a job somewhere. So the registration is one part, job is the second part.
Thank you, sir. Thank you for answering our question participants who is asked the few questions. And lots of appreciations came from the all the participants. So now I request our co-convener, Dr. T. Purushot Prabhu, Professor and Head of the Department of Pharmacognosy from the CL Baid College of Pharmacy, to propose the vote of thanks for the day of webinar 10.
Okay, thank you, sir. First, I thank management and principal Dr. Grace Ratnam, ma'am, who constantly support to conduct webinar 10 series in this pandemic. And my heartfelt thanks to my Mr. Deepu Prabhakar brother, who is my senior, who accepted to do webinar in his busy schedule. And the webinar is only for the students for their career prospects. He accepted immediately after I have called him. So I thank wholeheartedly Mr. Deepu Prabhakar for wonderful presentation, and it will be very useful for the students who are waiting for the career in overseas. And I thank him once again personally for accepting to do this webinar. I thank webinar team, Mr. Vijay Kumar sir, Ubaidullah sir, Mr. Sivakumar and Sadish Kumar for their encouraging support to do this webinar. I extremely thank Mybo team member Iswar sir and Nasik Basik sir. And I thank all staff member of CL Baid Metha College of Pharmacy and the participants of the students and delegates from various colleges. And once again, I thank everyone and happy Teachers Day to all my colleagues. Thank you.